Hi everyone, how are you? A 66-year-old man is undergoing a difficult laparotomy and there is bleeding. His blood pressure is controlled by administration of blood products and fluid. An adrenaline infusion is started. What will be the effect of this on renin? So a 66-year-old man is going through the difficult laparotomy and there is bleeding. And for controlling of the blood pressure, blood and blood product infused and also adrenaline infused is started. What will be the effect? Here the options are: it stimulate its release from the juxtaglomerular cell, it will inhibit it release from juxtaglomerular cell, it will inhibit in interaction with angiotensin 1, it renders it biologically inactive, and it accelerated its cellular breakdown. So, according to clinical feature, it is known to us that during the difficult laparotomy, blood loss occurs, and this condition hypovolemia develops. So, the volume is reduced. Volume is reduced, and for replenish of the volume, blood and blood fluid infused and also adrenaline infused, and we have to find out the action of adrenaline on the renin, or what are the function of renin in this situation. That means during the hypovolemia what will occur. So here we can see the renin, it is secreted by juxtaglomerular cell of the nephron, and the renin, it hydrolyzes the angiotensinogen to angiotensin 1. So here we can see renin has action on angiotensin, and then it converted into the angiotensin 1. Then factor stimulating renin secretion, here we can see hypotension. So in this patient, as the blood reduce, so a hypotension, that means the blood pressure reduce and the blood volume also reduce. So in this condition, renin will be secreted from the juxtaglomerular cell of the nephron. Then here we can see the hyponatremia. In case of hyponatremia, as the sodium, it contains water, and the sodium is responsible for increased blood pressure. So in case of hyponatremia, there will be blood pressure reduced and renin will be secreted. Then sympathetic nervous system stimulation. So here we can see this is the sympathetic nervous system stimulation. This point is very important. The sympathetic nervous system, this sympathetic nervous system is responsible for the renin secretion. So sympathetic nervous system stimulation, it produces adrenaline, noradrenaline, dopamine, dopamine. So the sympathetic nervous system stimulation and its products such as the adrenaline, noradrenaline, dopamine, dopamine, and other sympathetic uh, product, it will produce renin. So here it is our answer that the sympathetic nervous stimulation, it will increase renin secretion from the juxtaglomerular cell. Also the catecholamines are these the same product, that means the adrenaline, noradrenaline, dopamine, dopamine, and erect posture. In case of erect posture, there will be, due to gravitational force, some of the blood pool in the periphery, and relatively reduced blood volume to the heart and also the kidney, that will also release of renin. So here it is in short. In case of hypertension, here we can see in it is the kidney, and in case of hypotension, that means when blood volume is reduced. So when blood volume reduced or hypertension occur, then renin, first of all, renin released from the kidney and it is released into the blood. So renin, it is produced by the kidney and it is released in the blood, and in the blood, the angiotensin which is released from the liver, it circulates all the time in the blood. So the renin, when it released in the blood, it finds, or it see the angiotensin and acts on the angiotensin and converts the angiotensin to angiotensinogen to angiotensin 1. So this point is very important. The angiotensinogen which is circulating within the blood vessel, it is converted to angiotensin 1 by this renin, which is released by the kidney. Then angiotensin 1 it converted to angiotensin 2 in the lungs by this enzyme, which is the angiotensin converting enzyme. So the angiotensin converting enzyme, it converts angiotensin 1 into the angiotensin 2, and this angiotensin 2 it acts on the adrenal gland, release aldosterone, and it causes reabsorption of the sodium chloride and water, and it acts on the kidney, and reabsorption of the sodium chloride and water occurs, and it also increases the blood volume by preventing the loss of the water in the kidney. On the other hand, the angiotensin 2 it acts on the blood vessel and it causes vasoconstriction. So total circulating blood or volume will be increased and organ perfusion will be confirmed. So it is in short about the function of the renin. So again, see the renin. Here we can see the renin, it is released from the kidney, acts on angiotensin agent and produce angiotensin 1. Then from the angiotensin 1, angiotensin 2 conversion occurs by the angiotensin converting enzyme at lungs. Then this angiotensin 2 it acts on different part of the body, such as on the blood vessel, and causes vasoconstriction, and acts on adrenal gland, release of the aldosterone, and causes reabsorption of the sodium chloride and water. So it is now our answer is ready, that a 66 years old man undergoing difficult laparotomy, and at that procedure the bleeding occur and blood volume and blood pressure reduce. So due to pressure on the blood pressure reduce, the kidney will be stimulated and renin will be secreted. But here we have to find out the action of adrenaline on the kidney, and it is known to us that the adrenaline it also increase renin secretion, so it will stimulate its release from the juxtaglomerular cell and increase the secretion of the renin. So the function of the adrenaline here is increase renin by acting on the juxtaglomerular cell of the nephron of the kidney. Other option here, such as release of the juxtaglomerular cell, it is opposite function, so it is not true. It will inhibit interaction with angiotensin 1. It is not true, because interaction with angiotensin 1 occurs by the renin, not by the it occurs by the renin, not by the adrenaline, and it renders biologically inactive. It is also not true, because renin is biologically active and it accelerates its cellular breakdown. It is also not true.